Preparing, placing, and removing the dental dam. For this procedure, you will need the following equipment and supplies: a basic setup, pre-cut 6x6-inch dental dam stamp and ink pad or template and pen, dental dam punch, dental dam clamp or clamps with ligature attached, dental dam clamp forceps, dental tape or wax floss, a spoon excavator, and crown and bridge scissors. Be sure that you are wearing gloves for this procedure. Use the mouth mirror and explorer to examine the site where the dam is to be placed. It should be free of plaque and debris. Floss all contacts involved in placement of the dental dam. Any tight contacts may tear the dam. Punching the dental dam. Use a template or stamp to mark on the dam the teeth to be isolated. Correctly punch the marked dam according to the teeth to be isolated. Be sure to use the correct size of punch hole for the specific tooth. If teeth have tight contacts, lightly lubricate the holes on the tooth surface or undersurface of the dam. This eases placement of the dam over the contact area of the teeth. Placing the clamp and frame. Select the correct size of clamp. Secure the clamp by tying a ligature of dental tape or floss on the bow of the clamp. Place the beaks of the dental dam forceps into the holes of the clamp. Grasp the handles of the dental dam forceps and squeeze to open the clamp. Turn upward and allow the locking bar to slide down to keep the forceps open for placement. Be sure the closed portion of the clamp is pointed distally. Retrieve the dental dam forceps. Position the lingual jaws of the clamp first, then the facial jaws. During placement, keep an index finger on the clamp to prevent the clamp from coming off before it has been stabilized on the tooth. Check the clamp for fit. Lingual jaw placement serves as a fulcrum for placement of the facial jaws. Transfer the dental dam to the site. Stretch the punched hole for the anchor tooth over the clamp. Use cotton pliers to retrieve the ligature and pull it through so that it is exposed and easy to grasp if necessary. Position the frame over the dam and slightly pull the dam, allowing it to hook onto the projections of the frame. The open portion of the frame should always be directed toward the face. This ensures a smooth and stable fit. Fit the last hole of the dam over the last tooth to be exposed at the opposite end of the anchor tooth. This stabilizes the dam and aids in locating the remaining punch holes for the teeth to be isolated. Using the index fingers of both hands, stretch the dam on the lingual and facial surfaces of the teeth so that the dam slides through each contact area. With a piece of dental tape or wax floss, floss through the contacts, pushing the dam below the proximal contacts of each tooth to be isolated. Slide the floss through the contact rather than pulling it back through the contact. This will keep the dam in place. If the contacts are extremely tight, use floss or a wooden wedge placed into the interproximal area to separate the teeth slightly. A ligature is placed to stabilize the dam at the opposite end of the anchor tooth. Inverting the dam. Invert or reverse the dam by gently stretching it near the cervix of the tooth. Inverting the dam creates a seal to prevent the leakage of saliva. A spoon excavator can be used to invert the edges of the dam. When all punched holes are properly inverted, the dental dam application is complete. If necessary for patient comfort, a saliva ejector may be placed under the dam. This is positioned on the floor of the patient's mouth on the side opposite the area being treated. Removing the dam. If a ligature was used to stabilize the dam, remove it first. Slide your finger under the dam, parallel to the arch, and pull outward so that you are stretching the holes away from the isolated teeth. Work from posterior to anterior, using the crown and bridge scissors to cut from hole to hole, creating one long cut. When all septa are cut, the dam is pulled lingually to free the rubber from the interproximal space. Using the dam forceps, position the beaks in the holes of the clamp. Open the clamp by squeezing the handle and gently slide the clamp from the tooth. Remove both the dam and the frame at the same time. Inspect the dam to ensure that the entire pattern of the torn septa of the dental dam has been removed. If a fragment of the dental dam is missing, use dental floss to check the corresponding interproximal area of the oral cavity. Fragments of the dental dam left under the free gingiva can cause gingival irritation.